As a minimum, a manual tracking system should be in place to record the progress of RIMD through each stage of the decontamination process and allow retrospective demonstration that a particular cassette or single-item RIMD has been correctly decontaminated. By having a tracking system in place, the organisation can prove the sterility of the RIMD which are used for patient treatments. The dental healthcare worker reviews the graph printout produced by the ultrasonic bath and the graph printout of the washer disinfector on completion of the cycles. On completion of the cycle, document the details of the graphs, including the date, time, cycle number, the temperature and the holding time. The graphs must be signed by a person who is suitably trained. The dental healthcare worker then carries out hand hygiene. The dental healthcare worker then dons a new gown and surgical cap. It is recommended in the standards that a residual protein test should be performed as part of the weekly tests to establish the effectiveness of the washer's cleaning process. A residual protein test is carried out on one dental instrument after thermal disinfection in the washer disinfector. This test can detect traces of contaminating proteins present on RIMD after processing through the washer disinfector. The test consists of a swab and a container of reagents. The reagents undergo a colour change in the presence of protein. Select an instrument which has been used during an invasive procedure, for example, an extraction forceps. The manufacturer's instructions must be followed. Wear appropriate PPE as directed by the test manufacturer. To carry out a protein test, vigorously swab the RIMD using the test swab, focusing on hinges and crevices that may harbour traces of contamination. Unscrew the cap of the reagent container and swirl the swab in the liquid reagent for approximately 10 seconds. Remove and set aside the swab for discarding in the appropriate waste stream. Visually inspect the liquid reagent for any colour change, as this indicates the presence of residual protein on the RIMD and should be recorded as a failed test. Failure indicates inadequate cleaning, which may be due to low detergent, shadowing of instruments, or a blocked spray arm in the washer disinfector. Ensure all of these are reviewed and corrected before reprocessing the failed load. Ensure that all components of a protein test are disposed of as per the manufacturer's instructions. The dental healthcare worker then carries out hand hygiene. Once the protein test has passed, the dental healthcare worker can then remove the remaining RIMD from the washer disinfector. When dental handpieces are removed from the washer disinfector, they need to be lubricated. The dental handpiece maintenance system is a machine which propels an oil-based lubricant under pressure into dental handpieces. Lubrication is essential to ensure handpieces function correctly. Only use a lubricant recommended by the dental handpiece manufacturer. We are now ready to move on to step 4, inspection, and step 5, packaging. All RIMD must be inspected prior to packaging. Ensure that there is adequate lighting in the inspection and packaging area. Check that the inside of lumened RIMD, such as high-volume suction tips, are clear. Inspect all other RIMD for debris, rusting, breakage, and hinge fractures. Wrapping or packing a product in one or more layers of packaging ensures that the product will remain sterile after the sterilisation process is complete. Packaging pouches are frequently used for dental RIMD. It is important to place the handle of the instrument into the pouch first. When opening the package for instrument use, the handle is met by the user's hand first, rather than the working end. This can help to avoid a percutaneous injury from sharp instruments. When packing probes and sharp instruments, use tip protectors. This will not only permit safe handling of RIMD for staff, but also protects the sterility of the instruments by preventing puncture of the pouch. As a safety precaution, probes and sharp instruments can be double-bagged if tip protectors are not available. Each sterilisation pouch must be sealed along the perforated line to ensure that the bag is sealed correctly. Packaging of kits involves wrapping kits in a sterilisation wrap sheet. Autoclave tape is used to secure and seal the wrapped kit. The indicator marking on the autoclave tape and/or pouches change colour when exposed to the steam sterilisation process. We are now ready to move on to step number 6, sterilisation. The autoclave, which is positioned in the green zone of the LDU, is used to sterilise the RIMD after decontamination and packaging. This is achieved by steam sterilisation using a vacuum autoclave. Steam sterilisation is the recommended method of sterilisation in LDUs. There are a number of required tests that must be carried out daily and weekly before using the autoclave. RO water should be plumbed into the autoclave in order for successful sterilisation to take place. The presence of dissolved and/or suspended chemicals in water supplied to sterilisers can result in deposits on materials during the sterilisation process. If the RO water is not plumbed into the autoclave, it can be stored in easily identifiable containers. RO water should be stored in a cool area away from sunlight and high temperatures. The warm-up cycle of the autoclave is required to be carried out first thing each morning. The warm-up cycle is used to raise the temperature of the autoclave before the tests are carried out. This cycle may be selected from the types of cycles listed on the autoclave. If the autoclave does not offer a warm-up cycle, a warm-up can still be performed by selecting a Bowie and Dick cycle on the autoclave without placing a Bowie and Dick test into the autoclave. If a warm-up cycle is not completed, all subsequent tests will fail. The warm-up cycle graph printout should be signed and documented. When the cycle is complete, it is important to check the graph printout before moving on to the next test. The second test to be completed is the vacuum leak rate test. This test is carried out on a weekly basis to detect air leakage in the autoclave chamber. It is recommended to perform this test on the first working day of the week. Air leaks can result in wet packs, as leaks may affect the drying process. Furthermore, the presence of air in the chamber prevents steam penetration of the load and can prevent sterilisation. The third test to be completed is the Bowie and Dick test, which monitors an even distribution of steam penetration within the autoclave chamber during the cycle. The Bowie and Dick test must be carried out on a daily basis. The test pack is placed on a tray into an empty autoclave, run on a dedicated cycle called a Bowie and Dick cycle that is 134 degrees centigrade for 3.5 minutes. The Bowie and Dick test can signal the presence of non-condensable gases. Inadequate air removal manifests as air pockets in the indicator, showing a failure of the test. Upon completion of the cycle, remove the test pack from the autoclave, open the pack and take out the indicator sheet. The indicator sheet must have changed from a light colour to an even dark colour. If any difference in this colour is noted, repeat the test. Failure may indicate inadequate air or water supply. Review and correct before repeating the Bowie and Dick test. If the second test also fails, it should be recorded as a fail on the indicator sheet, the autoclave log page, and the graph printout should be signed and documented. Do not proceed to the next cycle until a Bowie and Dick test has passed and the graph printout has been signed. Validation is the documented procedure for obtaining, recording and interpreting the results needed to show that a process will consistently yield a product complying with predetermined specifications. The process of validation is to examine all aspects of the decontamination and sterilisation process to determine if they are operating and functioning correctly. An independent engineer test person from an outside organisation is required to service, repair and validate the ultrasonic bath, washer disinfector and autoclave on a regular basis. After each service and validation has taken place, a report is submitted by the company engineer to the customer. It is best practice to check and sign the validation reports prior to storage. It is a legal requirement to maintain and store validation records. If there are any failures of any of the cycles during the daily and weekly testing stage, ensure to report to the practice manager or decontamination lead. It is best practice to record and document all failures as part of the record-keeping files. If any of the daily or weekly tests fail, repeat each test again. If these repeat tests fail, do not use the autoclave. Contact the maintenance engineer to seek further advice. Once all daily and weekly tests have passed, you are now ready to process the RIMD through the autoclave. To do this, you need a tracking gun to label every packed instrument from the amber zone, which will then be placed in the autoclave trays. Ensure that the tracking gun cycle number corresponds with the autoclave cycle number, and that the correct date is also printed on the label. All tracking documentation completed throughout the decontamination cycle must be accompanied by the signature of the person completing the decontamination procedures. Once again, we return to the importance of maintaining a manual tracking system to record the decontamination process used on RIMD, to link them with patients on which they have been used. After loading the autoclave with the labelled RIMD, the dental healthcare worker selects the appropriate cycle for sterilisation, which is 134 degrees centigrade for 3 to 4 minutes. This is the recommended temperature that must be reached in order for sterilisation to be successful. The dental healthcare worker now checks the graph. This is carried out after each cycle is completed in the autoclave. The graph printout is designed to show that the operating cycles are functioning correctly, and therefore sterilisation has been achieved. The graph printout will give a reading of the sterilisation parameters that the autoclave has reached during the cycle. It is critical to ensure that this section of the graph is analysed correctly. The key parameters to be checked are date, cycle number, temperature, and holding time. The sterilisation holding time is the length of time the autoclave has reached and maintained 134 degrees centigrade and is the most important detail on the graph. 3 to 4 minutes at 134 degrees centigrade is required for effective sterilisation. Remember to sign the graph printout after each cycle is complete. Any cycle not meeting the criteria, although indicated as a pass by the automatic controller, should be rejected. The load should be repacked and sterilised, and the sterilizer removed from service until the cause of the fault has been established and remedied. A failure of the cycle recording device should also be a cause to reject the sterilisation cycle. When the autoclave is finished the cycle, it is important to use heat-protective and temperature-resistant autoclave gloves, as the autoclave chamber is hot. While removing the sterilisation pouches and kits, the dental healthcare worker inspects all RIMD packs for damage, such as ripping, tearing or pack perforation. If pouches or kits are wet, the RIMD have to be repacked and re-sterilised. Check that the colour indicators have changed. The next step of the life cycle is number 7, transport. The instruments are transported from the autoclave to the storage area. And here we move to step 8, storage. In the storage unit, instruments should be segregated and stored appropriately. Sterile items are to be separated from unsterile wrapped items at all times. Allow instruments time to cool before placement for storage. Sterile dental RIMD should be transported in a manner that will not compromise their status. Remember, contaminated items are to be separated from decontaminated items at all times. Decontaminated items are to be separated from wrapped items for sterilisation. Loss of sterility is event-related, which depends on the extent and nature of handling and environmental conditions during transportation and storage, and the quality of the packaging material. It is important to remember that dental RIMD must be stored at room temperature, must not be exposed to sunlight, must not be stored on the floor, and must not be stored under conditions where they could become wet or damp. The next step of the cycle is number 9, use. This is where dental RIMD are ready to be used. Instrument pouches and kits should only be opened once a patient has presented for dental treatment. Each pouch must be opened using the peel-back technique. The next step of the life cycle is number 10, transport. This is where used RIMD are returned to the local decontamination unit after use to commence the decontamination life cycle process. At the end of the working day, ensure that all graph printouts and related test results from all machines in the LDU are logged and stored so that they can be easily retrieved should they be required. Storage of these records is a requirement of the HSE standards and recommended practices. It is important to remember that each step of the decontamination life cycle is critical to the end product. Failure to adhere to any step in the decontamination life cycle may result in inadequate decontamination of RIMD with the possibility of subsequent infection of patient and practitioner. It is important that each local decontamination unit adheres to the HSE standards and recommended practices required for LDUs and the Dental Council of Ireland's Code of Practice for infection, prevention and control.